What a calcium score is it's a CT scan of the heart originally with no contrast. The nice thing about it is that you don't have to get contrast for one, and what we're looking for is calcium in the arteries around the heart. Now, when it comes to cardiac CTs, when we give contrast, this helps us evaluate the heart a little bit more closely. With a calcium score, you're only seeing calcified plaques and calcified narrowings of the vessels. However, one of the most common ways of developing a narrowing of the vessels is also what's called non-calcified plaques. So we can't see a non-calcified plaque on a coronary artery calcium score, but if we're doing a coronary CT where we're giving contrast, we can see both the calcium and the non-calcified plaque so that we can really give the best information to the patient there. If there's calcium in the arteries of the heart, the reason that it would matter is that can build up over time, cause a narrowing, and it can be the source of a heart attack later on. It can also break off and cause a heart attack, and it can really just be a sign of problems coming later on down the line in terms of even developing chest pain from small tasks during the day, like even just walking to the mailbox or even walking up the stairs if you've got too much calcium in your arteries. The reason that most people will develop calcium in their arteries is usually related to diet and lack of exercise. Doing things like eating fried foods, highly processed foods, or foods high in sugar or high in saturated fats usually and traditionally have been the causes of developing heart disease or developing plaques in the arteries. So the reason that a blockage in the heart may hurt is because you're not getting appropriate amounts of blood and inappropriate amounts of oxygen to the heart tissue that's downstream of that blood vessel. So think of it kind of like bending a garden hose and trying to water your lawn. You're not going to get too much water out of the garden hose. Cardiac CT, because of the way that the technology is advanced and the literature is advanced, if you have a calcium score of 0, then you have less than 1% chance of having a heart attack each year for the next 5 years. So if you have some calcium, that obviously increases your risk, but if you've got a 0, that's a very different thing. And that's a very large peace of mind that a lot of people will have for the next 5 years if they have that 0. It's often called the power of 0 in the literature. And I think that's one of the unique things, is that there's oftentimes when patients are going in for a stress test, there's a little bit of anxiety and fear with this because there's this idea of, well, am I looking for a disease? Versus with cardiac CT, while you also have that anxiety over looking for a disease, you also have that paired with this reward where if there is nothing, you can live with a little bit more peace of mind knowing my likelihood of having a heart attack is so low after getting it if you've got a calcium score of 0.